Selamat pagi semuanya, saya Ira dari Lavender Medicare. Hari ini kami mengundang Dr. Fiona Bu, seorang urologis dari Gleneagles Hospital, untuk membahas mengenai batu ginjal. Good morning, Dr. Fiona. Thank you for having us today and to share with us about kidney stone.
Hello Ira, nice to have you here.
Yes, thank you. Dr. Fiona, can you explain to us what is actually kidney stone?
Okay, kidney stones, right, are actually formed in the kidneys. They are hard objects, exactly like the stones you see on the floor, but they form in our body instead.
So how do we develop this crystal?
The chemicals are things like, maybe say, calcium, oxalate, uric acid, cysteine. So these are the chemicals that form stones. So, like I said, you need to have a small nidus, what we call nidus. It's the beginning of the stone, and everything deposits on it. So why does it form? It usually forms because we don't have a large volume of urine good enough to flush it out of the body. So as you can see, right, if the urine gets very concentrated, all these substances will actually get out of the urine, and then they start accumulating and form all these stones.
So is there any food or supplement or drinks that increase the chance of having kidney stone?
A high protein intake and a high oxalate and uric acid intake will definitely increase the risk of having stones. For the protein, for example, it will be things like beef, pork, other kind of red meat, and those for the Chinese, sometimes they eat a lot of the organs of animals. Those are very high uric acid and oxalate, so those food do make the patients form stone more easily. A high sodium intake, usually I'll tell my patients not to take too much sodium, because as we know, our Asian food has a lot of hidden sodium, so all these will cause easier stone formation. For the drinks, right, usually we'll tell patients not to take too much carbonated drinks, and of course to decrease the amount of caffeine intake, because there were some studies that show that excessive tea intake, it does cause stones. Then a lot of patients like to ask, what about calcium, like calcium supplements? Yes. For the calcium supplements, I would recommend that patients take the amount of calcium they need. So there are tables that help you calculate the amount of calcium you require. So too much of a calcium or too low of a calcium is not good for stones.
So it's not purged out from our body.
Correct.
The calcium.
If it's too high, right, it does form stone more easily. But if it's too low, it can cause other kinds of stones to form. So that's why you need to have a good amount of calcium every day, but not an overdose or underdose of it.
So we still need it, but not too much
Correct.
of it, not too less of it.
Correct. Especially for females, especially those patients who are menopausal. If there's too little calcium, right, they get osteoporosis, so it's not so ideal.
Okay, so everything in balance will
Correct.
be fine.
Everything in moderation. And for some patients, right, if they're overweight or they're obese, in other words, or they have previous gastric bypass surgeries or these, right, they do form stones more easily as well.
Okay, so it's very important to lose weight and maintain a balanced diet.
Yeah, that's right. And water intake. So I also discovered that a lot of patients who have stones, they don't take enough water, because in the Asian countries like Singapore, it's very, very hot. So we actually get dehydrated, especially when we go running or we do a lot of vigorous exercise, right? We are losing water and we are not replenishing enough. So when the urine gets very concentrated, right, the stones can form. Some people, of course, more prone than others, and we don't know why. For example, they may have family history of having stones. For me, it's either they have same diet, or they have some genetic, or congenital issues that we're not sure of.
So what kind of treatment option can we give for patient with kidney stones?
So the treatment options vary. So I'd like to use this to make it easier for your audience to understand. Okay. So the treatment options for stone depend on the site of the stone. Okay. So it can be anywhere in the kidney itself, the ureter, or even down in the bladder. Okay, the size of the stone. The bigger the stone, the more difficult it is to treat, with more sessions required, and the composition of the stone. Sometimes when we send the stones for analysis, we know what they are made of. And of course, sometimes when we test the patient's blood, we know that they have some issues with the calcium or with the uric acid. So we can make an educated guess as in what kind of stones it is.
So at the end, you can inform them how to prevent the stones from coming back again.
That's right.
I see.
So we'll explain a little bit about how the treatment options for different locations. For example, we have conservative, meaning that we tell patients to drink a lot of water. Okay, we give them some medications for the pain which they usually experience, and of course, and we give them some medication to relax the ureter so that the stones
Can
fall more easily. That's it.
So if there's no pain, is it possible to just leave the stone alone, or is it necessary for us to remove it?
Okay, so there are patients, right, who unfortunately have big stones, but they don't have symptoms. Somehow, can you just imagine the stone forming in the kidney? They don't drop out, so it just accumulates, like what we discussed just now. And in the end, they have very big stones, but they never felt any symptoms before. Those are bad, because if you don't have symptoms, you don't seek treatment. So your stones, right, eventually can cause a bit of kidney dysfunction. It can spoil the kidney.
So that means if it forms in the kidney, you might not feel any pain.
Correct.
If
Unless it drops out.
Unless it drops out.
Yeah.
If it's in the ureter or in the bladder, you might feel some discomfort.
Yes.
That triggers you to go to see a doctor.
That's right.
I see. So it's very important to have a health screening or early detection of the kidney then?
Yes, correct. So usually if it's on health screening, we find that the patient's urine have blood.
Yes.
So that's why we investigate further and we found that these patients have these problems, you see. We can also do other treatments if required. For example, if the stones are in the kidney, we can do what we call ESWL, extracorporeal shockwave lithotripsy, where we use energy wave to go for outside the body, and we hit the stone under X-ray guidance or ultrasound guidance, and then after that the stone fragments breaks, and then it just comes down like neatly. Yeah, correct. Because by breaking the stones, we make it really small, like sand. So when the patients have stone passage, they don't feel so much of a pain.
So this treatment is less invasive.
Yes.
Because it's done outside from X-ray.
Correct. Usually it's done under some form of analgesia or sedation.
I see.
Yeah. So it's good for patient in that way, you see, because they don't have to undergo under general anesthesia. And the only problem with that kind of treatment is that the patients, right, may have a bit of pain as the stones are coming down.
So if you can't do the shockwave, you will need to do a surgery then.
That's right. So let's say, example, the stones are lodged in the ureter with the patient having a lot of pain, okay, or it's very big. Then we have no choice but to put a scope up the ureter. We use laser. We break it to smaller pieces. Then either we clean it up by taking a basket and taking it out, or we fragment it until it's so small that you will just drop out naturally with the urine. So of course there's always a last option, which is PCNL, okay, which is a percutaneous nephrolithotripsy, whereby we actually put a scope through the kidney to get to a really big stone, and then we use either laser or we use ultrasonic lithotripter to break the stones, and then we retrieve the stone fragments. This is under GA and is more invasive because we go through the kidney parenchyma, which is what we call the flesh of the kidney.
Is it okay? Will it rupture the kidney?
The instruments used are quite fine. So of course we make a hole through the kidney, but it's not very big and usually it heals very well.
So how many days do they need to stay in the hospital if you need to do that?
For PCNL, right, usually we will recommend about 3 days.
After you remove the stones, is there any damage to the kidney
Yes,
function?
if the stone has been there for a while, sometimes, let's say example, it's in the ureter, right? The ureter might strictured. It has already scarred down.
Thank you so much, Dr. Fiona, for the information. Sometimes with our busy lifestyle, we forget to have a balanced diet, to exercise, or even to drink. Yeah, so it's a good reminder again for us to take care of our body.
Yes.
Thank you so much.
Thank you very much, Ira. Thank you.